there is no way I'm going to sleep with that big machine. I remember my father had it. It would make this terrible noise all night, and he had to sleep with this big mask on his face. No, thank you, doc. I am not doing that. Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. When many people hear the words sleep apnea, they immediately get a picture of a giant machine and a terrible experience that their uncle, father, or spouse had 20 years ago. The problem is that sleep apnea treatment has changed dramatically, and millions of patients don't know it. Today, we are going to talk about the modern treatment of sleep apnea, from newer and more comfortable positive airway pressure devices to weight loss medications, oral appliances, and even surgical options that many patients have seen advertised on television. Welcome back, Dr. Shah.
Thank you for having me.
So let me tell you a story of one of my patients. This guy is 38 years old. He's obese, or at least suffering from obesity, and comes in for a DOT physical. Now, as you know, the Department of Transportation wants patients with obesity to be screened for sleep apnea, as it should be the case. And when he tested positive, his top band questionnaire score was like 7/8. And I told him he might need a CPAP machine. He said, "Doc, there is no way I'm going to sleep with that big machine. I remember my father had it. It would make this terrible noise all night, and he had to sleep with this big mask on his face. No, thank you, doc. I am not doing that." So I wanted to ask you the question, what doesn't David know about the modern treatment of sleep apnea that he should know?
There's several options. CPAP actually is really the best option in many cases. Sleep apnea we classify based on what's called the AHI, is how many times you stop breathing or have very shallow breathing per hour of sleep.
Mm-hmm.
And that score gives us whether you're mild, moderate, or severe. If you're mild and you have your own teeth, you could get away with the oral appliance, which is something a dentist would make. It basically fits on the teeth and it brings the bottom jaw just slightly forward, a few millimeters. That's called an oral appliance or a mandibular oral appliance. Basically, that will get rid of your sleep apnea. The adherence is pretty good for that as well. And it's shown also to improve some blood pressure and other parameters for sleep apnea as well. So that is definitely an option. The second option I always say is CPAP. So typically moderate to severe sleep apnea, even certain mild apneas, depending on comorbidities, CPAP could be a very good choice.
So let me ask you something. What is a CPAP?
Yeah.
What does it actually stand for?
So CPAP is an acronym. It means continuous positive airway pressure. And so basically it's an amount of air that a machine, basically a compressor, is taking from the air, from the atmosphere, putting it through the machine, through a hose, through a mask that's going into your nose or your mouth. And basically it's a pneumatic splint. All it's trying to do is keep the back of the throat open. And at what pressure, and the machine itself basically will have algorithms to figure that out, what pressure it needs to keep the back of the throat open. And
so it's forcing air
it's just forced air
through the back of the throat to keep the door open.
Absolutely. That's all it's doing. It's not a smart machine. Although I will say that the newer generation CPAPs have an algorithm of flow, so it makes it a little bit easier. It's not just shoving the air in. It's going through different
calculations
right.
to determine how much air you need for the patient to be comfortable.
Correct.
Okay.
Whereas the old machines, it was just a pressure.
Mm-hmm.
But now the pressure is variable.
Okay.
So it makes it a little bit easier. Also, the air can be humidified.
Mm-hmm.
So it doesn't have to be dry air. So there's a water chamber that has distilled water that can add to the air.
Because that used to be one of the complaints of patients, that it gives them a dry mouth
right.
or they feel...
Right. So that they can turn up the dial as far as how much humidity or how less, and it also depends on ambient humidity outside as well. And then the other thing is the tubing itself can be heated. Now, the last and the most important is the mask, which we call the interface.
Okay.
The mask is really what I tell people is you want if you want a really good, comfortable pair of shoes, you want a really good, comfortable mask.
Okay.
And there are several types of masks. The three main types of masks, there's a full face that goes over the nose and the mouth. There's one that goes just around the nose. And then there's what we call nasal pillows, which go just inside the nose.
So let's start with the first one,
Yeah.
please. The full face.
Right.
Who is the best candidate to get the full face, or who should get that?
Yeah. Typically, people who are mouth breathers should really be getting a full face, because if you just have a nasal mask, the air is going to follow the path of least resistance. So if your mouth is open, it's just going to come right out the mouth. And so the pressure will be variable. That is going the other opposite way.
Yeah.
And so that's typically what I would say is someone that's a big mouth breather should try to get a full face mask. Sometimes people have, like men have facial hair, and so full face mask may not always work because it may leak through the facial hair. So that would be a caveat for men. But then there are also, the nasal and the pillows. I just want people to know that there are variations of each one, slight variations, so that if one's not fitting, they can try a different one. And typically in the beginning, especially when you first start out, the companies that supply the material to you, they will allow you to change the mask several times if you need to within the first 30 to 90 days.
Okay.
So if one you get home and it's not working, it's not fitting, it's leaking, it's moving, change that mask. You're at liberty to change it.
Okay. And how does the patient know that they are a mouth breather or not?
So many people do know that they're mouth breathers. If you do not know, then the machine actually will calculate the leakage from the mask,
Okay.
but can also tell you if things are kind of coming out of your mouth. You'll have worse dry mouth as well. You will know because the air will be coming out of your mouth.
Okay. So in simple terms, a mouth breather is a guy who sleeps with the mouth open and air's coming back and forth.
Correct.
Mouth wide open.
Correct.
Okay.
Correct.
All right. So now you mentioned the second type of mask.
Yeah. The nasal mask is the most common mask. It goes around the nose. There are many variations again. So variations I mean by sizes and also the fitting, how it fits on your nose. And so everybody has a different size nose, and so don't get stuck just with one. If it doesn't fit, you can always change that.
Okay, so the different sizes based on
Correct.
the size of people's noses.
And there's nuances, so it's not just small, medium, large. There are nuances, just like clothes, just like shoes. A size 10 shoe maybe slightly different in one brand and another brand. So very similar. There are brands of masks or companies that make those masks that have slight variations. So there may be like 50 different types of nasal masks. Obviously you don't want to go through 50 different masks, but 2, 3, are reasonable to go through just to make sure that you're getting the right fit.
And you mentioned the third type of mask.
Right. So the third type is called a pillows. It basically slightly within the nose and it covers the nostril basically. And so again, they have different sizes to cover the nostril to create a seal and kind of a suction within the nostril. And that's called a nasal pillows.
Okay. All right. So fantastic. This is the topic of positive airway pressure.
Correct.
How about other modalities? What else does the world of sleep medicine offer to treat sleep apnea?
Yeah. So now we have the Zepbound, which has shown some very robust data in patients with sleep apnea. It's a GIP and GLP-1 antagonist. So in the studies, it's shown to really decrease sleep apnea up to about 29 events per hour.
29 events per hour?
Yeah,
wow.
In some series. So that is huge. And so partly it's weight loss and partly it's other factors that affect the sleep apnea. And that's the only one really that's been studied of the GLP-1s specifically for sleep apnea.
That's interesting, which means I'm thinking about putting on my primary care physician hat now to get the patient approved for Zepbound. and overcome insurance company barriers, we can get the patient tested for sleep apnea. If they do have sleep apnea, refer them to a sleep medicine specialist to discuss their options, including Zepbound for treatment.
Correct. So they would need to have moderate to severe sleep apnea.
Okay.
Mild sleep apnea is not an indication for Zepbound.
And moderate for a patient looking through their sleep report.
Yeah.
How would they know if they have moderate to severe sleep apnea?
So again, it goes back to the AHI. How many times they stop breathing or have shallow breathing? 15 events or higher is moderate. 30 events or higher is severe. So 15 to 29.9 is moderate. 30 above is considered severe sleep apnea.
Fantastic. Now let's come to the surgical options. And I would like to start with the one that patients ask me all the time, the commercial that's always running on TV about the Inspire. Can you explain to us what's going on there? Because patients are asking about this.
So Inspire is what it really does is it has 2 leads. It's implanted in the chest wall subcutaneously. In other words,
so it's a device.
It's a device. And one electrode will go to the hypoglossal nerve, basically the nerve that innervates the tongue.
Okay, the nerve that moves, that helps you move the tongue.
Correct.
Okay.
And the other one will go to the chest wall, so it maps out the respirations and the stopping breathing. There's a remote control as well. And so basically you will turn it on when you're sleeping and you can turn it off when you're awake. And basically what it's really doing is it's making the tongue straighter. So the tongue is not obstructing the airway.
So it's getting the tongue out of the way.
Basically, that's what it's doing. Yeah. But in order to see if you're a candidate, first you have to have 1, moderate to severe sleep apnea. 2, you have to basically fail CPAP. 3, you have to see an ear, nose, throat doctor who is expert in putting this in. And they actually will do a scope. They will scope you. It's called a DICE. It's a type of endoscopy to look at the back of your throat and see what's actually collapsing. And they will determine if you are a candidate or not for the device.
Okay. That sounds like a lot of obstacles.
And there are certain people that are a better fit for that. Not everybody is going to be a fit for the Inspire device.
Okay. So is Inspire just a brand name?
It's the brand name.
Patented technology?
No, it's the brand name for that.
Okay. So you do
There are others. There are
others.
Yeah.
Okay. So these are just the ones we see on television.
That's the most common and the most, the brand that's kind of, I guess, the Nike of those type of devices.
Oh, the Kleenex.
Okay.
Towel.
Yeah.
Okay. So another question for you. How about surgical options?
Yeah. So there are many over the years. One is the UPP, basically clearing out the back of the throat.
Clearing out meaning removing the tonsils, the uvula.
Correct.
Oh.
Yeah. Depending on what, there's, where you can shave the tongue, part of the tongue. They have had very dramatic surgeries where they'll break the jaw.
Break the jaw?
Yeah, and then reattach. So, I mean, there's many, depending on, the facial structure. Those are really, at this point, if you would ask me that question maybe 15 years ago, it was a lot more popular. At this time, those are less popular, but still options, but very individualized.
Okay.
Yeah.
So surgery is really reserved for the highest risk patients who do not respond to anything else.
Correct. It's not really the first option. It may be the 3rd tier option or 4th tier option.
Okay. Let me ask you another question that I get very often from some patients. We do DOT physicals here. And so the guys who have CDL always wonder and feel punished for having to take a sleep study of being treated for sleep apnea and then having to produce the compliance report.
Correct.
Can you tell the general public why is it important for people who need this Department of Transportation physicals to be compliant with their CPAP treatment?
Well, the basics is that these people are driving trucks of any kind.
Yeah.
And that could be very dangerous on the road if you're falling asleep. And many of these people are driving long periods of time. And so they have risks of falling asleep, getting into accidents, and to kind of mitigate that risk that the DOT has stipulated that if depending on their BMI and what we kind of look at the stop bang, just by being a male is a risk factor on the stop bang. So if you have a BMI of a certain amount, if you have a neck circumference, if you're a male, I mean, these are all risk factors. And most of these are male with a certain BMI, with a certain neck. So they're at risk for sleep apnea, and therefore they need to be tested because it prevents a lot of deaths and injuries due to these accidents. And one way that DOT can kind of monitor if someone is being adherent is through the compliance data that the machine itself generates to show you that, yes, you are using the machine. And the minimum amount of time is 4 hours. And that's based on studies that show 4 hours is really where the benefits start happening for the use of CPAP. So obviously we want people to use it all night, but really that minimum is 4 hours and on a nightly basis.
And I will wrap this segment up by quoting to you back a statistic I saw that people who have obstructive sleep apnea have 3 times higher rates of accidents.
Absolutely.
Than people without sleep apnea.
Yes.
That is shocking.
It's not just that they're sleepy, but their reaction times are slower. They are also, their brain is sleeping. In other words, their decision-making capacity is decreased.
Yeah.
So there's many, many things that are involved.
All right. So I guess this is the part of the story where we really encourage patients that if they have been diagnosed with sleep apnea, they should seek out appropriate treatment, and there are different options. Can you just briefly recapitulate for the patients what options are available?
Yeah, so one of the options is a oral appliance, typically, again, made by your dentist or a sleep dentist. Another option, and one of the most common, is a CPAP, continuous positive airway pressure, which is a machine and a mask, and then medications such as the GLP-1 type medications that we discussed, the Zepbound, and then the hypoglossal nerve stimulator is another option for treatment. Obviously, this is also, we haven't mentioned, but weight loss and dieting and exercise are
the
obviously
foundation of everything.
Right. So that has to be understood that, we're not taking that out of the equation. That is the fundamental of the equation of just trying to lose weight and exercising and dieting and part and parcel of this whole treatment plan.
And you mentioned surgical options, but nowadays those are very few and they're left for people who really cannot tolerate any other treatment.
Correct. And that, again, we would, as a sleep specialist, look in the patient's mouth, determine that, there are certain things that possibly the ear, nose, throat doctors could potentially help alleviate some of the excess tissues that are there.
Okay. All right. As we wrap up, it means sleep apnea is not only preventable with healthy diet, exercise in the vast majority of cases, and weight loss, but there are also treatments, very modern treatments that fit the lifestyle of each and every one of us.
Absolutely.
Fantastic. Thank you, Dr. Shah.
Thank you.
This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.